Laos, in Southeast Asia, is one of the least developed countries, and in spite of increasing prosperity in recent years, children's healthcare is among the worst in the region. A great many children suffer and sometimes die from curable diseases. That's why Friends Without a Border and its founder Kenro Izu decided to start a new project and build a new hospital in Luang Prabang in the north of the country. After years of preparation, the hospital was officially inaugurated on February the 11th in 2015.
To me, the most touching moment was yesterday, 8:30, when I see the first patients. Last few years, we've been working on building the hospital and making a program and all those work. But finally, I'm so happy that we can contribute to the health of our children in Laos. So that was most moving moment. And by surprise, we have seen 47 children yesterday alone, the first day of opening. But I was quite impressed about our staff, especially Laos staff. They worked very nicely, smoothly, without much of confusions. And thanks to all those mentor teachers who has been giving training the last several months to the Laotian doctors and nurses and other staff. So this is quite impressive first few days of operations.
When Jonathan Spector, who is the first executive director, got up and spoke to everyone and said, "We promise," and he went through all of the promises that the whole staff made, and it was a promise to the world. It was a promise to all of us that they were going to uphold those standards, and that was a highlight for me, and I'll never forget it.
This team, the Lao Friends Hospital for Children staff, stand before you today with our promise to do our best to create an extraordinary hospital where children and their families receive the best possible modern, safe treatments, care delivered with respect, empathy, and compassion. We are eager to contribute to improve child health in the Lao PDR. We are committed to doing so, and we are ready to begin. Thank you. Khapchai Lao.
In a few months' time, the Lao Friends Hospital for Children is planning to open the inpatients department, to be followed by the emergency department. The ICU and a fully operational surgical unit is scheduled to open by the end of 2015 or early in 2016. We still need to procure the equipment needed to make the departments fully operational, and Friends Without a Border is still seeking donations and sponsorships for this purpose.
As you know, we started with outpatient services yesterday. We expect over the next 4 to 6 months to plug in the inpatient services.
Yes.
And then hopefully as soon as possible after that, the ER, the ICU, and then probably finally the surgical
by
services.
the end of the year?
That's our goal.
Okay. Yeah.
Preventive medicine and education to villagers about how to lead healthy lives are the most important programs which have already begun in 2014.
Outreach program, home care program, we have to go there and have to see and have to experience. Our home care and outreach program can find some better way or different way to help them. I think that's the purpose for this program. And then also, this is the individual visit for the patient, but outreach community program is we go to the community and then provide prevention education. And if they don't get disease, they don't have to come to the hospital.
Our goal is not just to provide a hospital, but also an improved and comprehensive health system beyond the hospital doors.
The United States is proud to partner with the Lao Ministry of Public Health in addressing public health needs. We're very happy to welcome Friends Without a Border as a partner in the public health efforts. I know that many of you have given much of yourselves, your time, and your money to make this project a reality. And I'm happy to see so many partners from around the world here to inaugurate this hospital.
The new Lao Friends Hospital for Children will make a difference in the health and well-being of the children of Lao.
My first impression was, wow, they did a wonderful job with the building and the spaces and everything involved. It's absolutely wonderful, and I was very pleased.
And I think he's got a great team there behind him and great support from a lot of people.
The LFHC will become one of the teaching hospitals in the Lao PDR. It will work together with the provincial hospital to improve healthcare and the quality and skills of the staff.
In the long term, we want to start working closely with the paediatricians in Vientiane and also our colleagues at Ank Hospital for Children to establish a 3-year paediatric residency program so we can train paediatricians in the northern part of Laos.
The work has just started. We have to continue to raise funds so that we can build our team here to provide the best medical care, so that we can continue with our education of the doctors and the nurses, and so that we can begin our community outreach programs, which are really important to really help make Lao Friends Hospital for Children the great success that Angkor Hospital for Children has been in Cambodia.
Just like the bird feels the coming dawn, we invite you to help with a new dawn in healthcare in the Lao PDR. Please help the Lao Friends Hospital for Children to provide better healthcare for the children of Laos.